Since the pandemic, I've noticed that masks make it harder to hear and understand what people are saying. But when can that be a sign of hearing loss? Dr. Gnewikow explains.
It's human nature for all of us to not want to admit a weakness that we have. So you really might have a hearing loss.
But I hear fine when I'm talking on the phone.
Well, the phone is an amplifier. You've got it against your ear. Alexander Graham Bell, the inventor of the microphone, was a deaf educator.
Ah, fascinating. Well, if somebody's in the same room with me, I hear them fine.
Well, because when you're in the same room, it's louder and you're able to look at them. And we all get information by looking at people's faces.
That's a good point. But the new TV programs these days are not like they used to be. There's too much background noise.
That is true. But people that have really good hearing don't really notice that as much. So if you're having difficulty with the background noise on television, it may very well be that you have a mild hearing loss.
What if you're listening to the kids or the husband and you're just trying to tune them out and you only hear what you want to hear?
That's a good excuse. I guess we all do that occasionally. But that is a primary excuse that people use when they don't want to admit they have a problem. I hear what I want to hear. But sometimes you may have not heard things that you really wanted to hear and you didn't even realize it.
If we're just sitting here, like in this room right now, and talking face to face, I can hear you just fine.
That's fine, because I'm closer, the signal is stronger, we're talking face to face, you're able to see me, and you would have no difficulty. Milder hearing losses don't exhibit themselves when you're in a face-to-face closed listening situation where there's not background noise. Most people with mild losses have absolutely no difficulty in that situation. But that doesn't mean you may not still be having them in other situations.
And these are a lot of excuses probably a certain amount of people in our audience have heard before. So how do you encourage your loved one then to come into an audiologist and talk to them?
Well, sometimes that's difficult. I've had a patient one time that came in only because his wife locked him in the car and brought him in. But if you're making excuses like that, the possibility is that you really may have a problem. This is being brought to the forefront by the mask. The mask is actually a diagnostic tool. A lot of people who thought they were hearing fine until a year and a half ago are beginning to have difficulty because they didn't realize how much they depended on looking at people's faces. And now, of course, we have a mask on, and that makes it more difficult. If you're talking to someone, the mask not only keeps you from getting the visual cues and information that helps us to understand, it also muffles the voice. So if you've got a mild hearing loss, even a slight muffling of that may really make a significant difference. So if you're seeing these things, there is a possibility you may have a mild loss that you're just not willing to admit. So it's a good idea, particularly if you have hearing loss in your family or you have any predispositions to hearing loss, like having been working in noise and things like that, to see your audiologist or your doctor and have a good hearing test done so that you have a baseline, so that if you have a hearing loss of mild nature now and it changes over time, we have something to measure it to and to determine how much it's changing over time. So early detection of hearing loss is very important. So if you have a question, get it checked. If the audiologist says your hearing is fine, don't worry about it. I see people every day that come in and think, I've got a hearing loss, and many of them do not have one. But I also see people that come in at the request of their family and they say, I'm really fine. And when we get finished, they realize they really did have a problem. So if your family is making comments, if your friends are making comments, if you're making these excuses, there is a possibility that you have a mild loss.
And to learn more, give Audiology Hearing Aid Associates a call in Lynchburg 434-528-4245 and in Danville 434-799-6288. You can also find out more online at digitalhearingforyou.com.